Well, good afternoon, everyone. I'm Chris Kane, Executive Director at Cpwr, and I'd like to welcome you to today's Cpwr Niosh bi-monthly COVID webinar on effective delivery of safety and health training during the COVID-19 pandemic. Before we get started, I'd like to mention that this whole COVID-19 webinar series is posted in a playlist on our YouTube channel. Today's webinar is on a topic that we've received several questions about throughout this series, distance learning. As we all know, the pandemic has caused rapid changes to the delivery of safety and health training. Our presenter today, Dr. Sue Ann Sharpe of Sharpe and Associates, LLC, recently completed a study for us that examines how distance learning evolved during this period and how it compares to face-to-face learning, and whether these programs are meeting their goals. We'll hear about the results as well as some tips and tools to deliver training effectively while also keeping workers safe. In addition, we have Cpwr's Environmental Hazards Training Program Director, Gary Gustafson, online with us today. Gary's worked closely with Dr. Sharpe on her study, and he and his team have had to adapt and pivot to a virtual training for several programs this year. So we wanted to bring him in for our question and answer session to share his experiences and expertise. We'll be taking questions at the end of today's presentation and have received quite a few during the registration process already. You can enter additional questions at any time in the Q&A box, and we will get through as many as possible. Dr. Scott Ernest, Associate Director for Construction, the Office of Construction Safety and Health at Niosh, will be moderating the question and answer session. And before we move on to Dr. Sharpe's presentation, I'd like to give Dr. Ernest the floor to share a few updates from Niosh and CDC. Scott, thank you for joining, and I will hand it over to you.
Okay, thanks, Chris. It's great to be here with everybody. Just a few updates. I wanted to start off just mentioning that COVID-19 cases, hospitalizations, and deaths across the United States are rising. As of yesterday, the total COVID-19 cases in the U.S. were 13,626,000. The total deaths to date were 269,763. As cold weather moves in, people are spending more time indoors and the holidays approach. So everybody needs to remember to take steps to slow the spread of COVID-19. These steps include wearing a mask, staying at least 6 feet apart, avoiding crowds, washing your hands frequently. The more steps you take, the more you're protected against COVID-19. A few other updates I wanted to mention over the things that have happened over the last few weeks. CDC had updated their definition of close contact, so it now involves 15 minutes of cumulative exposure in a 24-hour period. They've also recognized airborne transmission as another mode of transmission in addition to droplet and contact. And then they've modified some of the language on face coverings to indicate that face coverings do offer some protection to the wearer, although they're primarily a source control. The last thing I wanted to talk about briefly is just the development of vaccines. There's actually 5 vaccines that are in various stages of development, most in phase 3. Those vaccines are from 5 different pharmaceutical companies: AstraZeneca, Pfizer, Novavax, Moderna, and Janssen. And CDC has an advisory committee that's looking at prioritization of groups that will get vaccination, and some of the groups that will be at the high priority would include healthcare personnel, workers in essential and critical industries, people at high risk for severe COVID-19 illness related to underlying medical conditions, and people that are 65 years and older. So that's still being worked on. But that's the update from CDC. And with that, I'd like to turn things over to Dr. Sue Ann Sharpe to talk about the work she's doing on training. Dr. Sharpe?
Thank you. Good afternoon, everyone. I'm going to spend a little bit of time this afternoon talking about a study that was conducted. It's actually 2 evaluation studies that were conducted during the COVID pandemic. As we know, in March 2020, COVID was declared a pandemic, and there was an immediate need for worker training on COVID-19 at a time when designing and delivery training in real time to meet those needs was quite a challenge. There was a rapid transition from the traditional face-to-face health and safety training to health and safety training being delivered via distance. So with that in mind, excuse me, you can tell I'm not too facile with the technology myself. I apologize for that. In response to that, we set about creating some rapid evaluation studies. And the first study we're going to talk about this afternoon was a comparison of face-to-face versus distance learning format. When you do this kind of rapid transition, there's a need to compare the new format to the format that's sort of the tried and true gold standard, which is face-to-face. So we'll talk a little bit about that. And then also to take a deeper dive into the health and safety training that was designed and delivered via distance learning and how it met the emerging safety needs going on during the pandemic. And from that, we were able to establish some best practices and lessons learned that we then translated into some tools and tip sheets for trainers that I'm going to share that information. And also today in the discussion, we'll talk a little bit about what are the next steps then for distance learning with respect to health and safety. When we set out to do the comparative study on the face-to-face versus distance learning, we decided to target the ICRA course, the Infection Control Risk Assessment Training, as our target safety course. And that was for really two reasons. One is it was provided pre-pandemic in a face-to-face format. It was modified during the pandemic to a distance format that included a COVID component, but we had the same instructional team for both formats. So there was somewhat of an apples to apples in terms of the instructor effectiveness and this instructor translation. And so we looked at the training face-to-face from April 2016 to the pandemic, which was February 2020, and then the distance clearly was from the March translation to distance learning trainings to July 2020. So as I said, for those of you that aren't familiar with ICRA training, I just wanted to give a brief background slide. It's the course that prepares workers to perform construction, renovation, maintenance, and demolition activities in healthcare facilities, mainly hospitals. And it involves the hallmark of the Cpwr training is active learner participation. So it involves case studies, lectures with discussions, demonstration, hands-on activities to engage learners and to make them a part of the process. Pre-pandemic, it was an 8-hour face-to-face training, and it was revised during the pandemic to a 6-hour training, one of which hour is the COVID-19 and construction industry awareness training, hereafter COVID training online. So our first study was to do a comparison of those two courses, and it was a rapid assessment. Cpwr has an existing course evaluation, 26 items that they give immediately following all of their training. So we use that as our measure of effectiveness. They measure instructor effectiveness, teaching and method, material effectiveness, and overall effectiveness, as well as learning. They have 8 knowledge and skills that are associated with a standard knowledge battery with safety, and we were able to do direct comparisons of the immediate effectiveness of the face-to-face versus immediate effectiveness of the distance. And when I say immediate effectiveness, what I'm saying is the evaluations are gathered immediately following training. So we looked at were there differences in this effectiveness in learning. And this slide gives you a summary of the results. And I'll give you a minute to orient. The distance learning is in that sort of burnt orange color, and the face-to-face is in blue. And what you see right away is overall, the results are quite positive, certainly for the gold standard face-to-face. And this is on a scale of 1 to 5, 1 being most effective. What we see is the ratings are quite high for both, but certainly, as you'll see, the asterisk, the single asterisk is at 0.05 and a double asterisk is 0.01, but there are significant differences between them, and in particular to the method. And what we're seeing is overall face-to-face was scoring, was rated as more effective and than the distance learning, although both were quite high, but what we didn't see significant differences in was the learning. So we wanted to go into a deeper dive of Why were we seeing these significant differences in effectiveness? Not unexpectedly, because of the rapid translation and because we know the strength of the CPWR training in the face-to-face format, but how were they able to translate that training so quickly where there was no significant differences in the learning? So we did study 2. And study 2 was designed to, as I said, just to focus on the distance learning courses themselves. And we designed a evaluation directed at distance learning, and it was all the courses, those COVID courses and the ICRA COVID courses. The COVID courses is a 1-hour course, and the ICRA COVID is a 6-hour that also contains the COVID course within it. And to be really clear on what this distance learning looked at, because I've got questions that I saw that were given to me ahead of time of which type of distance delivery did you examine. To be very clear, this is synchronous online format. This is taking the distance learning and mimicking it as closely as possible to that gold standard face-to-face. So it was presented synchronously over Zoom. When I do evaluations, if you know my work, I try to get as many of the stakeholders in the process as possible. So we got feedback on the distance learning, not only from the folks that received the training, the members, the trainers, the union reps, but also from those providing the training. The CPWR instructors also filled out the survey for me to give me their perspective because we felt that was very important as well. And we did an online evaluation on September 2020. So what you'll see is this one is more of a looking at 3 to 6 months after the beginning of this training, what are the results looking like? And as I said, we created an online distance learning evaluation. It was very targeted, and it looked at instructor effectiveness, content effectiveness, because the COVID portion was brand new and targeted just at what was going on within the pandemic, and then also the format. For the learning, I really liked the knowledge, skills, and abilities that were included on the CPWR training evaluation. So we repeated those, looking at those learning skills, but I also added in items looking at transfer of the training to performance on the job and looking at support on the job. We know from safety climate, and particularly with COVID, that support of the training is crucially important. So what did we find? Well, just to give you some background, we did the survey online and we got a very healthy response of 100 survey respondents. And the people taking the training, it was pretty clear split, not 50-50, but close to it. A little bit more took the COVID, but 56% of our respondents took the COVID-19 and 44% took the ICRA COVID. So we had a good representation of the trainings that were provided. When we look at the date they attended the training, there was also nice dispersion here as well. More of the respondents had attended during the July to August timeframe, but we also had almost similarly in the very early phases of the pandemic, March to April, we had folks that took the training then and responded. Trainee background information. Just to give you a little idea of who were our respondents, when you look at race, ethnicity, and you look at gender, what you see is there was some variance among the different race and ethnicities, but clearly we have more of a predominantly white male response. There were a few females and a couple of people that preferred not to answer, but primarily it was white males that were responding to the survey. Similarly, with the professional tenure, there were no pre-apprentices that responded. We had a smattering of few apprentices, but primarily we had journey workers. And then when you looked at their union membership, we had 50% of respondents, their responsibilities were union trainers, but we also had a fair representation of union, just members and union representatives as well. In terms of the trade affiliation, we had 8 different trade affiliations that were represented in the sample. The most often reported were the painters and allied trades and elevator constructors, but as you see, we had a varied representation among the trade affiliations. So training effectiveness. So what did we find? So, and I'll give you a minute to orient to this slide. This is when we looked at training effectiveness. I got feedback both from the CPWR instructors, and they're in the burnt orange, and also from the trainees. And you can think of this in terms of when we look at multi-stakeholder feedback, we look at, who are the customers. So the blue is more the trainees, the customers of the training. But essentially what you'll see is the follow-up scale that I created was on a 1 to 7 scale. And you'll see that there were relatively high ratings, again, 3 to 6 months following training in terms of what they felt was most effective. What we saw here was even after they had transferred the training subsequent to their instruction in the online setting, they were still reporting relatively high levels of instructor content format overall effectiveness, with, similar to Study 1, instructors' effectiveness being reported most highly and format effectiveness receiving the lowest ratings. What was striking here is that the CPWR instructors themselves were giving relatively lower ratings than the trainees. And what we interpreted that as, in talking with them, as the idea of continuous improvement. This is a brand new format for them. They have very high standards in their face-to-face training, and they felt there was room for improvement. Learner outcomes. So now we're seeing where the rubber meets the road. This is 3 to 6 months following training. What are we seeing in those KSAs that we measured immediately following training? And what we're seeing is on the 1 to 7 scale, these are quite high ratings, 7 being the highest rating. I strongly agree that they have maintained this training, maintained these knowledges and skills as a result of the training. I don't have them listed here, but I can go over them when we take questions and answers. But just to let you know that the use of PPE was the highest scoring KSA. Safety at the workplace. This is something that is not as often measured in safety and health training, but is, I think, arguably one of the most important measures of the effectiveness of training when we look at the impact of working safely on the job. And what you'll see here is the respondents reported quite high levels of actual use on the job 3 to 6 months post-training, as well as supervisory and organizational support. So what you see here is measures of not only high levels of effectiveness, high levels of learning, but also high levels of transfer to improve safety on the job. Another measure that we took, and we had a branching in the evaluation survey that I created, where if you were a trainer and you took the training, we wanted to see subsequently to taking this training, did you feel prepared to train others using distance learning? And as you recall, 50% of our respondents were trainers, and what they said was, yes, for the most part, they did feel prepared, with, roughly 3/4 of them saying they were very prepared in terms of then being able to subsequently train their members in use of using distance learning in the COVID and IPR-COVID training. One of the things we were trying to get a good feel for, because this is new in terms of distance learning and health and safety, is did the participants, the trainees' work expertise affect the training outcomes? So we looked at union membership, we looked at trade affiliation to see if there were any differences on effectiveness ratings and learning and performance, and what we found was no, in fact, there were no differences among the different roles, member, trainer, union rep, and the 8 different trades that were represented in our sample. Another question that I got a couple of this ahead of time that you all sent was, does the length of training affect these results? Does the types of training affect these results? So what we did was we compared the 1 hour COVID ICRA with the 1 hour COVID with the 6 hour COVID ICRA to see if the length of training seemed to have an impact, and we found no significant differences. I do want to stress here that CPWR, because this is such a highly interactive type training, split up the 6 hour COVID ICRA into 2 consecutive days of 3 hour segments. So it was really comparing a 1 hour training with a training that was given 2 3-hour sessions. But again, there were no significant differences, and there were no significant differences in the time of training. If it was early on in the pandemic versus late in the pandemic, we weren't seeing significant differences with that as well. Another question that's often asked is, well, how about the technology? This is a new foray not only for the CPWR instructors, but also for the individuals taking the training. How does that affect the outcome? So we looked at technical competence in two ways. We looked at skill in using distance learning. Do you feel that you're skilled? And we found that most reported they were in the skilled to somewhat skilled range. And did that impact the ratings? And what we found was it did impact the training outcomes in terms of the ratings of instructor effectiveness and overall effectiveness, and very importantly, in terms of learning. Those that are more skilled were reporting higher levels than those that were somewhat skilled. What about comfort? Well, as you'll notice on this slide, more folks said they were very comfortable, and what that means is, are you comfortable in taking the training online? And 88% said they were either comfortable or very comfortable, but we did have a somewhat meaningful 12% that were either somewhat comfortable or somewhat uncomfortable. How does that impact training? And that's where we saw a large difference. It wasn't just in, effectiveness of instructor content and format, but it was also on the transfer outcomes of the continued learning, of the performance on the job, and of their reported supervisory support. So what we see here is that the trainees' comfort in using this technology is quite impactful in terms of the training outcomes. So why did these results occur? We didn't just get quantitative information, we got qualitative information, a lot of qualitative information. If you get the report, there's a lot of rich information, but I tried to distill it down into really what they reported across respondents of what's most valuable and least valuable. And resoundingly, just as the quantitative results showed, instructor expertise was quite important to this group and quite appreciated. It wasn't just that these are very highly skilled, highly technical instructors, but it wasn't just what they had brought in, what they're bringing to the face-to-face, they were bringing into the distance. It also was their level of motivation in terms of just jumping in with both feet, being willing to just take on that format, try to make it mimic the classroom as closely as possible, and bringing the learners along with them. So there was a great appreciation of this quick shift to distance learning, being flexible, being encouraging, using that synchronous online platform. And we know Zoom can have all kinds of issues with it, but that they were highly, what they weren't skilled, they would acknowledge, and they would bring the learner along with them. The other thing in doing that, they were able to draw in more of the learners with respect to the application of the content, so that they could apply it to their workplace, and we saw that when we saw the transfer of training to their work setting. The other thing, because they used the synchronous platform, they were able to have interactions, discussions, breakout rooms, polls. The idea was to have as much learner engagement as possible to keep the attention going, because that can be difficult, particularly as the sessions are longer with distance learning. So what did they find least valuable? It is clear that, we all know that face-to-face is the gold standard, and it was clear in the responses that, and both quantitatively and qualitatively, that the face-to-face is seen as more effective. And part of that is, much as you try to mimic the interaction, there is limited interaction. There is challenges to the hands-on. There are real, in terms of trying to translate to completely imitate face-to-face. Hands-on is a great challenge. The technical issues, screens freezing, people dropping, bandwidth issues, computer issues, and alongside of that, the instructors and the trainees say, they read a room. There's a sort of interpersonal relationships that are very natural in the face-to-face format that don't translate well. One of them is like limited verbal cues. So it's harder to do that in the online. So there are challenges to that. So how do we combat that? Well, what we were able to do, because as I said, I got a copious amount of qualitative information from the instructors and from those attending, and I was able to come up with the tools and tip sheets for trainers, and I won't go into these exhaustively, but what I do want you to notice right off the bat when you look at this is these 10 recommendations. The bulk of them go before training. Preparation and coordination, just as it is in face-to-face, is probably even more important in that distance format. So as you're translating the material, it's important that you focus on, before training, be as prepared as possible, knowing as much about your audience as you can. This can also be in terms of when you think about, before training, getting the learner as comfortable as possible. So not only did they say, you know, it's helpful to have instruction orientation training for instructors, it's also helpful to have it for participants that clarifies sort of the rules and what the expectations are and gives them information ahead of time. And again, as I said, the planning meetings are vital, planning and coordinating, not just before the first day of training. I want you to understand, if there's multiple days, the debrief at the end of training that you do in face-to-face, you need to do in distance. So if you have a day 2, there needs to be a planning meeting for day 2. And also, just as I've had to do, is the idea of rehearse. Practice, practice, practice with the technology for trainers is absolutely vital. I was asked to create an online etiquette sheet for trainees. The trainers said this would really be helpful to them so that they can give sort of trainees help with the orientation and the expectations. So I'm not going to belabor this, but we created that we can share with you with a report, an online etiquette tip for trainees so they know they can sort of check the boxes before they attend training of what's expected and what they should be doing. During training, just as with the face-to-face, the key is encouraging engagement, encouraging interaction, using diverse methods. But also, when you do that, be aware that you need some sort of support. Resoundingly, I heard, I don't know how you do this alone. So just as Jessica is helping me with the technical assistance today, there needs to be a co-instructor or some sort of support with the technical assistance. This is not something you want to do as a single trainer without some assistance. The other thing is, I stress that there's planning meetings and coordination meetings, but I also stress that don't be so structured that you're not being flexible. The idea of creating an open, flexible environment, because just as stuff happens in the face-to-face, stuff is going to happen in the distance format, and you need to be as prepared as you can that during training you're able to be as flexible as possible. One of the things that I was asked, and I won't belabor this, but can you put together our best practices for breakout rooms? And so what we did as part of the report is we did put a best practice guide. Breakout rooms are being used so often. They're so critical in terms of group discussions and engagements. And so this gives you sort of a heads-up check sheet of what you should be thinking in the planning stages, and then as you're conducting breakout sessions within your distance learning. And then following training, I am an evaluator. I'm someone who says, evaluate every training that you do. One of the reasons we were able to get results in real time for this evaluation, and we got so much on support right from the beginning, was the idea of Cpwr really instills the idea of continuous quality improvement. It is really important to keep these evaluations very directed and short, but to keep evaluating so you do have an idea of why you're getting the results you're getting. The other thing that I feel is really important to share with you is if you're engaging in distance learning, there's a level of expectation with the learners or the trainees that you're going to be providing online resources following training. Cpwr has really good COVID resources, and they have a website, but they also provided, aside from access to their website, at the end of each training, they provided the websites and online resources for Niosh and Cdc. The learners expect that, so you need to have that sort of in your toolbox of what you're going to do following training. This quote is something that I like to share, and it really just encapsulates the idea of what they were conveying to me, that, it's face-to-face training certainly is the gold standard, but there was such a need for distance, and there is an art to safety. And it really is the idea of taking these best practices, taking what we're learning with the distance learning, and doing the best job that we can in the interim so we can get back face-to-face. That is so greatly appreciated by the learners, and it's really why I'm here today to share this information with you. So now, as I said, we're trying to balance the idea of distance learning for health and safety moving forward, and how do we use what we've learned now as we keep proceeding through the pandemic, right now there's so many cases surging. How do we use this information to grow within and improve within our use of distance learning, but also how do we think about this, God willing, when we come out of this pandemic and go back to face-to-face, how can we use what we've learned to improve our face-to-face trainings. So what I would say to sum up is we did find strong preliminary evidence that distance learning format was successful in delivering this health and safety training in real time in response to the pandemic. Moving forward, I think we need to get a better understanding of the trainee characteristics of what we can do in order to meet their needs. As I said, the demographics were fairly narrow for this study, so as we move forward, we may want to, gather more information on various subpopulations, but also various training features. We looked at synchronous online using Zoom, so there's a lot of information to be gathered as we look at integrating this what we've learned into the face-to-face offerings, be it blended learning or flipped classrooms. The other thing that I think we should consider is beyond the standard reactions, learning, and performance measures is start looking at some of the more intangible relationship outcomes, measures of cohesion, measures of peer support and trust, and looking at how those compare in the face-to-face versus online and how to build those kind of training outcomes. And we were sort of pushed into distance learning. It was hard for businesses to be strategic and for training centers to be strategic. But now, as we get more and more of this information, it does afford us an opportunity to now integrate this information into improving our health and safety training systems. So with that, I'd also just like to make a quick shout out, some acknowledgments to my colleagues, Alicia and Stikowski and Nancy Goldstein. They were my collaborators in this process, and the Cpwr, Gary Gustafson, Steve Surtees, Rick Reinhardt. This was a collaborative project. The Cpw instructors were vital. We got such good responses because we got such tremendous support from them, and also from NIHS for supporting the funding. And with that, I hope I stayed within my timeline well enough. I would like to open the floor to questions and open it up also to Gary.
Okay, thank you, Dr. Sarpy. And with that, we'll go ahead and start into a number of the questions we received through the registration initially, and then if there's time, we can hit some of the questions that came in on the chat. So the first question is for Dr. Sarpy. What would be the one thing that is needed to determine if the training is understood by the participants?
Yeah, I think that's a great question, and I think it's hard to say there's one thing needed, but I would say I would encourage, and this is some of the feedback I got, and this is also supported in the training literature, is to the extent that you can, I was saying it's difficult to read the room in distance learning. I think the use of, as much as you can, of the polls of the different sort of, people gave suggestions like Quizlet, Kahoot, where you're actively assessing learner knowledge and learner engagement along the way, I would say is vitally important in this distance learning format. I think it comes more naturally to us in the face-to-face, and I think it's something that you really need to think about in the design and execution of the distance.
Okay, great. Thank you. And the next question is for Gary. Again, it's through the registration process. And this question is, we will be doing respirator fit test training, train the trainer. Can that be done remotely, or is that something that the participants need to practice on each other to learn?
Hey, Scott, thanks. That's a great question. And the best way to answer that is that there could be components of that training that distance learning could be effective to address. But obviously from the question, the parameters, because of the face-to-face component of fit testing, there will have to be some form of assessment done, of the individual wearer. So hard to, right now, hard to do in a distance format, even with active video, to be able to see everything and to understand it. But I think what we should do is look at the opportunities you can take now to address some of the knowledge-based components of training using distance learning. And so when you do go back to face-to-face training or in-person training, you could really maximize the amount of time spent together and maybe push through maybe a backlog of workers who need that face-to-face element.
Okay, thank you, Gary. Appreciate that explanation. Next question is for Dr. Sarpy. What is your best recommendation about making the training feel like it's in person when you have to perform it remotely?
Okay. Yeah, that's a great question. I think part of it you have to focus on what the content of the training is, and if it's more of, declarative factual-based knowledge versus the procedural or more of the skill set kind of knowledge. But I think that focusing on, the thing that I like to tell folks is when they're interpreting these results is the things that really are the skill set, the hallmark, the strong suit of the CPWR face-to-face training were the same components that were cited as most effective in the online training. So I think what you need to rely on, particularly for adult learners, is techniques that are the most engaging, the discussions, bringing them interactively into the training, particularly in the distance, to keep them more attentive. And I think to the extent that you can integrate that in, we see so much more of a knowledge acquisition and knowledge transfer, because then they start bringing in their own issues that they have within their workplace, and you're able to integrate that into the discussions.
Okay, great. Thanks for that explanation. Next question is for Gary. What are the best ways to provide safety training via video conferencing?
Thanks, Scott. That's a big question. So obviously many of the ideas that Dr. Sarpy addressed in her recommendations need to be applied. I think the thing that we learned quickly was to keep the classes small. The propensity is to think that, in a virtual distance class, you can, I don't know, there's 300 people, I think, on this webinar, and to sit there and say, I can do 300 people of training, like this. And what we learned is that that's not practical. Keep it small. That allows that engagement to happen. In all of our training programs, we liberally used the breakouts, which then took a large training classes. Our training classes never got bigger than 20 to 24 people, and using the breakouts then divided that down into smaller sections. So we then had one-on-one, as Sue Ann said, we utilized a lot of co-instructors. I mean, one of the things that we learned was we need more trainers actually in this distance learning than less trainers. We found that to really be effective, to maintain that interaction with our students, we needed to have more trainers, because let's say in a face-to-face classroom, when you do a small breakout and you have 4 tables in a classroom, one instructor can bounce around and see all of that. A little bit harder in the distance world. So what we did is we provided more interaction by having more trainers. So I think that, to make the health and safety training better, continue to focus in on what makes your activities participatory. How do you get the students engaged? How is it, you can still do things like, showing pictures and asking for, ideas, suggestions, showing small videos and following it up with questions. So a lot of the same techniques you would use in person can be done in a distance learning. You just have to strategize on how to do them best.
Okay, thank you, Gary. And another follow-up question for Gary. What's the allowable limit for the number of students in a classroom? Is there a capacity cap on training? Our annual refresher training is coming up, and I'm not sure how many to keep in the classroom without putting anyone at harm of exposure.
So, great question again. And so I'm just going to talk about, limit of people in a classroom and a virtual classroom. If you're talking about in-person classrooms, that obviously is going to be site-specific, because you have to look at local health protocols and stuff. So let's just talk about distance learning classrooms. And again, it goes back to what's your manpower to provide that interaction or that engagement in the classroom. So if you're one trainer and you're trying to look at distance learning as a way to provide the health and safety information, your classes are going to be much smaller than, say, an organization who could put 4, 5, 6 trainers. And I'm serious. Some classes, we had 6 trainers for a population of 25 to almost 30 students, because our main focus was ensuring that each student had access to an instructor to ask questions, to be engaged. So that's how it's going to happen. As it relates to in-person, it's such a hard question because you are going to have to look at your local protocols.
Okay, thanks for that question. Here's another one for Dr. Sarpy. We've heard that virtual training should be shorter, otherwise the attendees will tune out and the information won't be absorbed. If that's true, is it possible to deliver the same amount of information in a shorter training class? Should multi-day training include off days? Okay,
I think this is such an excellent question, and it's something that I've heard different iterations of. What is the sort of optimal combination of both how long each training segment should be and then how spread out each training segment should be. And when we think about it, they call it sort of like mass training versus sort of distributive sessions. Do you have it all at once? Do you have it in smaller bites? Do you have it spread out? I would have to say we did not find significant differences in this training, but it was a very specific type. I think the technology you use is going to dictate that. And what I would argue is I think we need to have more investigations of that. I think it's a very insightful question. I think it's one that this data set gives some preliminary evidence of, but I think more studies are needed in that, because I think what we're seeing in other domains, such as in medicine and in higher ed, they tend to say the shorter sessions dispersed over many days tends to be better, and I think this needs to be tested out in the health and safety domain as well.
Okay, great. Thanks for that response. And another one for Gary. We still need to do some training in person, especially hands-on training required for some equipment certifications. What do you suggest for conducting this type of training?
Again, obviously COVID-19 protection protocols have to be, the first thing that you think about. This question's been asked because even, in the construction industry, we never shut down. We had, workers out there the entire time, and same thing, many of them had to make sure that, they received proper training and equipment. The answer is you just have to think about the safety protocols first for dealing with the COVID exposures. After that, there are various resources around the internet. Cpwr has a COVID clearinghouse, and one of the documents we have up there is a guide that can help address as you return or as you do in-person training. We also have a website that will help build a COVID safety plan, which designed for work sites, but also could be adapted to use for training centers. If you are doing in-person training. So, again, to answer the question, Scott, I think that the first thing you always have to do is address the COVID protections first, and then adapt to the hands-on pieces around it.
Got it. Thank you very much. And then a follow-up question for Gary or for Dr. Sarpe. There's been a tremendous push to do more training via online web presentations. However, OSHA often has requirements for hands-on components. Are there any recommendations on how to handle the conflict?
Gary, you want to take that?
Got it, Sue-Ann.
I want to say that, in terms of, are there limitations to what you can do with distance learning? I would say, yes, there's limitations. So there may be hands-on components, that the hands-on demonstration that may be quite logistically quite difficult to translate to the distance format. So I think while we've seen that it was quite effective in getting information during the pandemic, everything has its limitations. So I think that's why, as Gary's saying, you have to be very careful about, what you're doing face-to-face and how you're doing it, but recognize that some of these hands-on demonstrations, particularly with certain types of equipment, it just, practically speaking, it just may not be doable via distance or that I've seen yet via distance. So I think there are limitations to what this format can do, in my opinion.
And I agree with Dr. Sarpy that, there are, just like any, other types of training, there are limitations to what you can do. And I think what we have to continue to look for as this expands are lessons learned. People are going to try it, and I think that's a great thing. We need to expand our knowledge of how this can be used, because if you think about it, and I just look back to where I started in March to where I am here today in December, and what I know about the distance learning technology and the core group of trainers that we have, and how they've expanded their knowledge and of the delivery mechanism. We continue to address those questions, and so I think you need to continue to share with colleagues what you're doing, what you're learning, what you're experiencing, because there may be an answer. It may come soon. It may take a little while yet, but I think it's possible. I just don't know it yet, and I look to the training community, the occupational safety and health training community, to keep talking together, keep sharing the ideas, because I think that's how we're going to solve this.
And Gary, to Gary's point too, I'd like to say the amount of research that's going on right now, this rapid research, this real-time evaluations, and the amount of information sharing across domains, it's really exploding, and people are very eager to share this information. As we can share this information from this report with you all, we're finding that, the research in education where they had to, in K through 12, that had to go online very quickly, and in the higher ed that had to go online very quickly, we're sharing resources with each other, and so we are getting different perspectives, and that is making the translation of things that I will say may look limited now. They may come up, as Gary said, we may have findings in a month that really address this issue very directly. And Scott, I saw one question Stacey Smith had in the Q&A. Can I just address that, if that's okay?
Absolutely, sure, go ahead.
Okay. One of the things Stacey was asking about was in remote training. She feels like she's speaking into a void. Stacey, I share your pain, because I feel that I'm much, much better face-to-face than I am in webinars. And she was asking, they try to get them to turn on their video. In that tips and tool sheets that I gave about the trainees that you can share with them and set trainee expectations, one of the things that the trainers have told me resoundingly is, if you're doing the synchronous format, have them keep their video on, that it makes a tremendous amount of difference in terms of being able to feel like you're in a classroom and share, information. That having the video on, as Stacey was asking, is that important? That's critically important, and you can have that as one of the learner expectations, and you can set that up in advance ahead of time, because I would say, particularly in the synchronous format, that's vital.
Okay, that sounds good. Another one that came in on the chat is from Josh Retzliff, and he's asking, what's the best virtual platform for using the breakout rooms? I haven't used a breakout room before as a trainer. Any thoughts on that? So,
I can only address it really from both personal experience with the Zoom platform. Cpwr utilizes the Zoom platform, and the funny thing is, everybody, asks, well, why did you use Zoom? And I'll be honest with you, when the pandemic hit in March, it's the name I heard. It wasn't well thought out. It wasn't as if I spent hours, researching. It was the one that was in the news, and it was the one that we went to, and at the time, it addressed our needs. And so, and as you've all have read in the news, they continue, the Zoom company continues to refine their product, and which is, exactly what I think all of the platforms are doing. So whether it's Adobe Connect or WebEx Classroom or any of the other number of platforms that are out there, you're probably already engaged in one. So you just have to continue to, look at its possibilities. But there are a number of white papers that are coming out and, comparing the different platforms, and so you can take a look at that. That might help. But yeah, as to the platform, it was the news.
Got it. Makes sense. Okay. Another question from the registration. We're getting kind of short on time here. We've got a few more. Do you have any recommendations? This is for Sue Ann. Do you have any recommendations for web-based, smartphone-accessible pre- and post-training surveys?
As Gary said, there's several evaluations that are available that I can, if you email me, I can share with you. But quite honestly, most of the evaluations now that training providers and training centers use come in through services like Qualtrics or SurveyMonkey or SurveyGizmo, and they have within those, embedded in those, where you can easily translate those surveys onto smartphone accessible. So in all likelihood, it's a very easy translation system. The one thing that I will tell you, and it's part of why I think we've got a strong response rate, aside from the support that I received from Cpwr, is we were very pointed in. We keep the surveys very directed, the questions very directed and very short. And particularly when you're using smartphones and you're having them fill out the surveys on smartphones, please be aware these really super lengthy surveys your response rate is going to be dismal with them. So along with just translating it to the smartphone app, the smartphone format on these Qualtrics, that's pretty easy. But make sure that you keep it short if you want to get responses with it.
Okay, thank you.
Mm-hmm.
Another one that came in on registration for Gary. Conducting orientation training is a challenge, especially in cold climates when the program is 2 hours in length. And conducting sessions in a construction trailer is high risk for COVID. What are other companies doing to overcome this at a reasonable cost?
Well, that's an interesting question. So, job site orientation training. That's the possibility of trying a blended approach, where maybe a company could develop a distance learning session that new workers could attend virtually, and that way they could then minimize the amount of time that they would need to be face-to-face in a job site safety orientation. I recognize that you have to have some face-to-face interaction, and during that job site orientation, there might be forms to fill out or something of that nature. But I think if you can, one is, again, I'm going to stress it, practice your COVID protocols. So make sure those are all in place, but maybe look at transitioning some of the content that you cover in your orientation to a distance learning format. And I'm not talking about putting it online, a click-through PowerPoint, something that would be engaging with the workers through an instructor-led presentation.
Okay, thanks for that answer. And we'll have just one more question here, and then we'll wrap things up. Let's see, this is for Dr. Sarpe. Do you have any suggestions for remote assessment of comprehension other than through a survey?
Gosh, that's a great question. I would say the same techniques that are used in the face-to-face comprehension, where you have the demonstrations and the activities, while they can be a little trickier online, I would encourage using those same type assessments in the online format. I'm trying to follow sort of what they mean, but I'm assuming they mean just a knowledge assessment of self-reports of knowledge you can do the testing pre and post. But if they're looking for the actual procedural knowledge with the demonstrations, again, that is something that I think the information that I'm getting back is that we are getting more facile in doing more of that sort of online activities and online demonstrations of those activities where you can assess learners' knowledge in real time. And I think as we get the techniques more refined with that, just as you do in the face-to-face, we'll be able to do more and more of that effectively in the online format as well. So I think you're going to be seeing more of that emerging too.
Okay, very good. Thank you so much for those answers. I want to thank everybody who called in today and thank each of you for the great questions that were provided. I want to thank Dr. Sarpe for a very interesting presentation, and also Gary Gustafson for weighing in on many of these questions that we received. And then just to wrap things up, I want to remind everybody that the next bi-weekly COVID webinar is going to be December 17th at 2 p.m., and we're going to be having Dr. Marianne D'Alessandro, who is the director of Niosh's National Personal Protective Technology Lab, and she's going to be talking about respirators and face masks, just kind of understanding exactly what the differences are and how to wear them properly to protect from COVID-19. Thanks a lot, everybody. Have a great rest of your day. Take care.